Unfortunately, the experience that Paul has just set out regarding his father is an all too familiar case for many pharmacists, and we became aware of the problem, the growing problem, particularly over the last year. And last summer the IPF conducted a survey of over 500 pharmacists to find out what was going on with stock shortages and indeed what the impact was. And we were interested in two particular areas. First of all, the impact obviously upon patients, but also the impact upon pharmacists, the time that they were spending sourcing drugs and the impact that that has upon their business and indeed the broader service that they can provide. And in that survey we found that 50% of pharmacists were spending up to 3 hours each week sourcing drugs that had gone into short supply, and that might mean a considerable amount of time on telephone chasing those drugs. 11% were spending between 3 and 4 hours, and there was a small percentage that was spending more than that. Now that's time that isn't paid for by the NHS, it's time that those pharmacists could be engaged in frontline support in providing advice and services to their patients. But we also found that up to 30% of 30% of those pharmacists believed that in that week before, when we surveyed them, between 5 and 10 patients that week had been affected by a shortage. 21% said that between 11 and 15 patients had been affected, and over 15% believed that more than 16 patients who come through their pharmacy in a week had been affected by stock shortages. And those cases that we then were beginning to hear about showed that they were quite devastating, the sort of circumstances that Paul has outlined that have a real impact upon patients, not just in terms of the physical not being able to get the drugs, but psychologically because of the fear of not being able to get hold of particular drugs. And sometimes that would have an impact on the relationship between their pharmacists, because as you will hear in the next two speeches, the process is very complicated. But if you're a patient, you expect to be able to go to the pharmacist with a prescription and to receive your drugs. And if you can't receive them, then you assume that the problem must be with the person that you're dealing with. Actually, as you'll hear, and many of you will know, the problems are varied, they're many, and they're quite difficult. But in some cases, we found that patients were blaming the pharmacist, very much unfairly so. And that's why the IPF has spent a lot of time on this, and that's why we're very keen to be able to support this and to see a solution come out of the discussions that the all-party group have, and hope that it brings some pressure to bear upon the government to try and find a solution with the industry and with all partners. Thank you.